Dr. Chaseley, I'm a facial plastic reconstructive surgeon. Practicing medicine in the U.S. is not like what you guys are able to do here. Me, my two sons, we were all scuba diving in Belize. Everything's fine. We'll get right back to the dock, and I have a stroke. The place where I had my stroke, it's called the basal ganglia. It's in the middle of kind of everything, motor movement, thought. Got my butt down here pretty quickly. I did 80 million cells intrathecal into the spine, and then 2-3 weeks after I got back, I was able to walk without a cane. I wasn't banging my toes on the ground and dragging it. And then by the time I get to July or August, I'm walking 2 miles a day. I'm starting to do curls with a 1 pound weight. Came out for a second treatment in October, and that's when things really took off. By the time November and December hit, I was carrying a 30-pound rucksack, 2 to 6 miles a day. If I'm not doing things that I think are important to me and the people in my life in the next 6, 12, 18 months and I have another stroke, I'll be fucking pissed. But if I've taken care of my life, my sons, my family, my friends, and I had another stroke, I'm okay with that.
CPI Podcast. I've got Dr. Chaseley here with me today, and I'm excited to do this podcast with you because although we do get a bunch of doctors down here, when Lola from Aftercare is like, you got to do a podcast with this guy. He's super cool. He's had incredible results. Before we get into those incredible results, tell us a little about yourself. What kind of doctor are you?
Yeah, I'm Dr. Chaseley. I'm a facial plastic reconstructive surgeon, and my practice is in San Jose. And related to my injury and treatment, I was in neuroscience before all of that, and I'd more or less forgotten almost all of it until I had a stroke last June, and that's how I ended up finding you guys. You guys were on my radar already just for general health and prevention, but, that event on June 9th really catapulted me into this clinic in short order. So
give us the, story on, what happened and how you ended up here.
Yeah, sure. Just a quick aside, the place where I had my stroke, it's called the basal ganglia. It's almost like if NVIDIA designed it, it's in the middle of kind of everything, motor movement, thought, initiation of thought, management of emotions, not the emotions themselves, but your ability to kind of keep things in. So there may be times where I have a kind of a ridiculous smile on my face, or even I get teary-eyed about something that seems kind of minor. And internally it may actually feel that way, but the regulation of the expression of that is pretty out of whack right now. So if I get a little teary-eyed or kind of laugh or smile, sometimes it just seems out of place.
I'm just going to pretend you're laughing at one of my dumb jokes.
Okay, thanks. I appreciate it. So, I was me, my two sons, close friend Yolande. We were all scuba diving in Belize. Ironically enough, my close friend Tony was with us. He and I were getting our rescue diver certification that week, and we had gotten it, completed it on Thursday. Went out, celebrated. My sons, older friends were having a great time. I went for a really nice dive the following morning, June 9th. Was diving through some caverns and even some what we call swim-throughs, but you would think of it as a cave, but it's got an outlet eventually. And that went beautifully. I was shooting film of that, and it was a really tight space. You can hear my tank kind of scraping against the reef in the cave. 10, 15 minutes later, I'm on the boat. Everything's fine. We get right back to the dock, and I have a stroke. And at the time, or at least I thought I was having a stroke. Turned out I was right, because I was having symptoms on the left side. The left arm went limp, face went limp, speech got slurred, difficulty swallowing, and I definitely couldn't walk. And so, just trying to rule out the most common things. I'd done multiple deep dives for 3 or 4 days in a row. So we went to the HBO chamber to get treated for decompression sickness, and that ended up not being the case. And eventually had to stay there overnight, and then took a air ambulance back to Belize City, which was actually quite the ride. So, yeah.
Wow.
Yeah.
So what was the actual how was the stroke caused? How was it?
Well, there's a little bit of speculation. Depending, some physicians I saw, their first reaction during this period of time was the vaccine, and I'd been vaccinated in a year and a half prior, no boosters or anything like that. I didn't really think that had anything to do with it. And if you were going down a checklist of ways to have a stroke at a fairly young age, I met some of those. At the time I was almost 240 pounds. I was muscular. I lifted weights, but my blood pressure was high. My cholesterol was high. My stress levels were massive. After 2020, running a plastic surgery clinic and being a plastic surgeon became pretty arduous. Like if you were an empath and the way your patients felt was really important to you, it became really hard to manage. I mean, people my mother's age and in their 50s who never even heard of TikTok, never used Instagram, during 2020 and 2021, they started using all this stuff. And then there became this massive disconnect between what they saw on a screen and what was, real, and how they viewed themselves in a mirror versus how they viewed themselves on a digital screen. And it became really problematic, and it just became more and more stressful. Patients became less patient and just uglier at times to me and the staff. And I asked around all my other colleagues, and it wasn't just me, it was happening everywhere. So my blood pressure was quite high. The day I had the stroke, my blood pressure was 190 over 110, which is, enough to put anybody in the hospital. So cortisol, I think you're probably aware, like that will destroy tissue. And mine was elevated chronically for a while. CRP, inflammation markers had been up for a while. So a combination of things, I think really, lifestyle, work, stress levels, hypertension, all that.
So it wasn't necessarily a scuba diving.
No, ended up not being.
Just timing.
Just timing. We
never know when that day is going to come, right?
Everybody's got a number for a lot of different things. You just don't know what it is. And that was, so not related to the trip. I could have had it at work in the middle of a surgery. I could have had it at home, sitting on the couch by myself, but I was with my sons. That was the only upsetting thing about it. At the time, I was, having been a physician and having some background in neuroscience, as I'm having my stroke, people were asking, were you scared, that sort of thing. And I was pissed because I'm laying there and I'm thinking, okay, well, I'm conscious. It's not hemorrhagic. It must be, lack of blood flow, ischemic. So I'm most likely going to live through this without any trouble. And I'm thinking about the timeline as they're wheeling me off the dock to put me in a station wagon that was, this is San Pedro Island, Belize. Like, it's a great place, actually pretty good medical staff and facilities, but, not all the bells and whistles, not free of sand and that kind of thing. And I'm just angry. I'm just like, what the fuck? I've got 12 to 18 months to get to a point where I'm decently functional. And they took me to the bariatric chamber. We did a 5-hour round of that and started a second protocol, and that just made symptoms worse. And then you might find this amusing. I didn't know what was going on, but you're a pilot, right?
Yes, sir.
Okay. So we're in what I would describe as sort of a 6-8-seater Cessna of some sort that's converted to take on a
Probably
patient.
205. Yep, I know.
Yeah. So there's this dude from New Zealand who's the pilot. There's this guy Desi who's the nurse, the flight nurse. They take me over there in the station wagon ambulance. Door shuts on the back. I'm looking at my sons through this dusty, sandy rearview window. And, this, when you're scuba diving, the sign for everything be okay is this. It's not this. This means go up, ascend.
Yeah.
And I just gave this to my sons.
Yeah. How old were your sons at the time?
At that time, they were 16 and 20. Now they're 17 and 21.
Yeah.
And the 21-year-old has his private pilot's license. So anyways, we get to the airstrip. We get in the plane, and I can hear the pilot talking to my buddy Tony, and he's telling him to hold the door open. He's like, there's not enough ventilation. It was quite hot. So we start to take off, and he's like, just, when we hit 150 feet, 100 feet, just close the door. So he's like, are you serious? And he's holding the door open to get some ventilation as we're taking off from San Pedro to hit Belize City. And then he's like, all right, go ahead and close it. And he shuts the door. And, I guess we took off with the door open, which I didn't really know what was going on at the time. I was trying to look over my head and see what was on.
Yeah. It's weird, the things that we remember.
Yeah.
Like that. Some years back before COVID, I was in Cabo and tried to stand up from a dinner table to go to the bathroom and I said, "Oh, my legs feel weak," and then I just passed out.
Shit.
And one of the only things I remember was this lady coming over and asking me over and over again, "How old are you? How old are you?" And I'm like, "Who cares? Like, what do you mean? Like, I'm trying to stand up, like what's going on?" Never got fully diagnosed, but some of the doctors say, "Oh, maybe you had a little stroke," which was like a little scary. Who knows exactly what happened?
People do get random idiopathic, fainting, syncope. Sometimes it's a thing.
Be the first time for me ever, but it was. I wasn't too scared.
Yeah.
I actually didn't really realize what had happened until, I was back up and being drugged back to my room by people.
Yeah.
What happened, but luckily I got to the hospital down there, and I kind of know what you're saying. The hospital in Cabo, they were struggling to get an IV in me, and I looked down, and it looked like there was probably the layers of 14 or 15 different people's blood that had dripped down and dried up on the floor.
Christ.
I was like, I guess they don't clean the floors here too frequently. Or there's been a lot of people here today.
Well, look, I didn't have anything quite like that, but but the staff at the hospital in Belize City, it was a small subspecialty hospital. We're talking 4 or 5 beds, 5, 6 rooms, 1 OR, servicing that whole area. But I had the same 2 or 3 nurses. They were awesome.
Yeah,
really good. So, but straight away I'm sitting there. You're trying to solve problems, come up with solutions to problems that don't even quite exist yet. I'm trying to figure out what I'm going to do with my clinic. And at the time, this did not work at all. I mean, it was just at my side. I couldn't move it 10 degrees away from my body. I couldn't shrug my shoulder. Definitely couldn't, articulate my fingers at all. But weirdly, even in the first 2 weeks after this had happened, I would yawn and my arm would shoot up and my fingers would straighten out. So I was thinking, okay, there's circuitry there. It could be remodeled. Something could be done. And I thought about you guys, started hitting up. I just put inquiries in, and then got contacted by one of your coordinators, Jordan, who, works from the States. I believe she was in Tennessee at the time or something like that. And within, there's with pretty much any injury, stroke, torn ACL, whatever it is, or even recovery from a surgery, you've got this early stage of healing and inflammation where a lot of things can be manipulated or improved or made worse, whatever the case may be. So my goal was to try and get out here within 6 to 8 weeks. And that happened June 9th. I was in Belize for a week on a anticoagulation drip. Got shipped back to Texas. They redid the whole workup, and everything was cool. I mean, it was as cool as it could be. And then I got booked out here. I went back to California. I was here the 3rd week of July, within five weeks or so, or a little less, for my first round of treatments. So,
yeah, I try to tell people all the time, the time is now. The longer you wait, whether it's torn meniscus, heart issues.
Yeah.
In your case, especially with stroke, always we get helped by a lot of patients want to know about dementia, Alzheimer's. It's MS. The sooner the better.
Yeah,
it's always the sooner the better. So you're a doctor. What is it about that quick time frame? What's your body doing?
Well, so in the case of a stroke, I mean, similar to other tissue spaces in the body, wherever that stroke happens, you start to get necrosis of the tissue that was there, the cells that were there. In this case, functional motor cells in this area called the basal ganglia. And if we wait too long, or almost, if you read up on nerve regeneration in the brain or the central nervous system, it's essentially you'll read that it's not a thing. It doesn't really happen. There is very limited stem cell content in the human brain in just very specific areas, but it's not like it'll migrate around the brain, or it doesn't have access to other areas of the brain, so to speak. And so if I waited too long, the space, I think we were able to reestablish some blood supply to the area through anticoagulation, improved blood pressure, and so on. But if I waited too long, the space where those neurons had started to die off was going to be replaced with something called glial cells, or a variety of different glial cells, which is just scar tissue in the brain, similar to scar tissue in a joint space in a knee, for instance. And so that process starts very early on, but it really starts to solidify going into 2 and 3 months. Again, that's pretty similar to other parts of the body. So I was trying to get out here as quickly as I could. I didn't really know what the options were after talking to Jordan, and she contacted the medical team. That she was saying, well, you got intrathecal, which is, injection into the cerebral spinal fluid space. It's essentially a spinal injection. And I was like, well, that sounds pretty good. The only other options I found was a study at a university in the Bay Area where they were trying to introduce stem cells directly into the brain through a stereotactic where they do guided needle. Like they drill through the bone and they're going to introduce it to that area. But that you can imagine that has pretty massive risks to it too. And I was like, well, this is bad enough already. So I liked the intrathecal idea, and I got my butt down here pretty quickly. And first round of treatment that I've done, and this is my third visit. I'm not doing a spinal this time, but the first one I did 80 million cells intrathecal into the spine and 120 million IV or systemic. So, because there are other parts of my body that needed healing at that time as well.
Sure. And so, well, take us through it. You came down here, you got treated. Like, what was it? How long till you started seeing some results? And what did you see first?
So, come down, get treated, and the early aftermath of that, I'll kind of touch on that later when it comes to what people should be doing when they go home after just any treatment, some general guidelines. But once I got back home, I had gotten to where I could move around by, say, week 3 with a cane without assistance, and I was
week 3 when you came back from
just in total
or from here.
Week 3, I could use a cane to move around, but the leg wasn't really functional. I could keep it stiff. And so I could sort of bounce along a wall with my shoulder and use the cane, kind of tripod myself between the cane, this good leg, this bad leg, and a wall. When I got to here using the stairs, my back was literally just against the wall, and I was sliding down with assistance in the cane just to get downstairs. And got treated here. That went really well. Everything was very smooth. I don't recall the procedure at all because I was sedated. Every joint space injection that anybody gets, obviously you have some discomfort the first night and the first week. That's a normal thing. As you guys say, the inflammation is important. Embrace the pain. You're going to have pain. So I was pretty uncomfortable off and on for a week. I got home. Like I said, wasn't really able to move around much without a cane or without somebody assisting me. And somewhere around 2 or 3 weeks after I'd gotten home, which makes sense regarding the cells and the timing of their ability to start doing their work, so to speak. I was able to walk without a cane. The gait was pretty awkward. My arm was still just hanging completely dead. It would get puffy because there's no venous return. There's no muscular contraction I'm not doing anything with it. And, dragging my toe between the time I went to y'all's place and when I was in Belize, the shoes I had were all tattered and were getting pretty badly damaged, but I had to keep them on in the house to keep from damaging my feet. And then, like I said, 2-3 weeks after I got back, I was able to walk without a cane. I wasn't banging my toes on the ground and dragging it. When I moved forward, I was able to kind of, not a true curl, but I could bend at the elbow and get my arm up kind of awkward like this. Just the weight of it. I could get to about 90 degrees, whereas previously I couldn't do anything. I was able, after that amount of time, I was able to stay home and take care of myself for the most part. And, a lot of improvement, but fairly gradual at that stage. And then by the time I get to July or August, I'm walking pretty regularly, like I'm walking 2 miles a day. I'm starting to do curls with a 1 pound weight, but everything, like I couldn't really grip anything with any intention. Like I couldn't reach over and grab that bottle the way that I do now. I'd try and make coffee, and I would turn. You're also not really aware of what the left side of your body is doing if your stroke is on the right side. I mean, it's there, but you don't really have awareness of where your arm's going to be with any one motion. So it would just swing around, and I was breaking coffee pots by accident. I was knocking people's drinks over at restaurants, walking past their table, because I just wasn't aware of how close my arm was to them or their belongings or whatever it was. There's quite a few awkward interactions between me, husbands, wives, kids, that sort of thing, because I was just sort of banging into people. And even when I didn't need a cane, I started carrying one around just so people would turn and see me, and it was more believable that
give you a little more
yeah, because
leeway.
I mean, at the time I was still 225-ish pounds. I hadn't really leaned out that much or lost a ton of muscle, so I think I look relatively young for being 46, and I would tell people that I had a stroke. If I didn't have that cane, like it took some convincing sometimes. But when I really didn't need it and I was able to avoid doing all those things, that was probably about 2 or 3 months after the treatment, and I came out for a second treatment in October, and that's when things really took off. Like November was
So after the second one?
Yeah.
Okay.
Second one made a huge difference.
Second intrathecal again. What was the dose? Do you remember?
The second intrathecal was 100 million cells, and then the IV was 150. So I went up on everything. Yeah. The other thing that I did differently after I got home from that was I would eat once or twice a day. But I would eat a massive bowl of food. Like I'd get these huge pho bowls. I'd fill them with protein, raw vegetables, some rice, kimchi, and that would be my 1 or 2 meals per day, and that was it. So I was more or less fasting for 12 to 18 hours a day sometimes, and I started all this out at 235, 240, depending on the week and what I was doing. And I got all the way down to 187 so quickly that I started making smoothies with frozen black cherries in it, just a few, plus other fruit, walnuts, things like that, just to have extra calories that weren't like ice cream or processed things. And I slowed my weight loss down, and I got down to 187. Now just kind of hover around 193, 195.
So was the weight loss from not being able to work out or from eating healthy?
I think it's both.
Both.
But the reason I bring up the diet is, there have been some studies where people have looked at how you eat after stem cells or any type of surgery, and intermittent fasting and that sort of thing. And this isn't really a pitch for intermittent fasting, but it's definitely a good way to lose body fat if you're eating a lot of protein and a lot of other good fruits and vegetables and starting to work out. So at that time, I could really walk for long distances. I started walking ramps at the garage or parking garage close to where I live. And by the time November and December hit, I was carrying a 30-pound rucksack, 2 to 6 miles a day. I'd stopped driving to the grocery store, and I would put a backpack on, and I would walk to Sprouts, fill it up with whatever it was that I needed. And that was about 6 miles round trip, and I would do that a couple of days a week. Now, because this was completely diminished from the stroke, this took the longest to come back. All this motion, the fingers moving, that sort of thing, this is fairly recent. This is, I would say since January, and it just it's sort of hitting this like upswing, like it's really taking off. So at that time, I wasn't really able to do any kind of upper body workouts. Like when you're laying in bed that first week, if you haven't done the things you need to do in life, you're thinking about all the things you should have done or would do if you could. And one of them was like push-ups. I'd done plenty of push-ups, but I was like, man, if I can ever do one push-up, I'm going to do 1,000 of these motherfuckers. And so I can do push-ups now. It's still a struggle, but now I'm starting to get so much function back. They're interfering with one another. So this basal ganglia area of the brain, it's got multiple nuclei, and one nuclei will literally tell another one to like chill out because it's sending inhibitory signals to your frontal cortex where you initiate movement, constantly telling it, not to move. And then once you have a thought that you're going to move and do something, it'll send a signal to one of the other nuclei, and it'll tell that nuclei to be quiet. It'll allow the signal to pass to your leg or your fingers, your hand, whatever it is. So I was getting opposing muscle groups. Like if I was doing something with my bicep, my hamstring would fire. If I was doing something with my fingers, my toes would sort of claw back on my shoes. And so I was getting other issues. Like when I do a push-up, my calf is firing to the point where it's actually cramping up. So I'm doing the push-ups, I'm doing the upper body stuff, and I'm starting to get some muscle back. And it's just so much has been going on. It's hard to describe it in a real clean timeline, but it's been going really well. So
that's awesome. That's really interesting. It's cool that you're so knowledgeable, right? I mean, you probably know more than I do for sure. I'm no doctor about this, and I can relate to that. When I had my back surgery, I pretty much lay flat on my back for 8 months. After a couple months, I was supposed to be up and trying to walk every day, but it was super painful. Just little by little. But it was 8 months before I could get up on my own, walk around and stuff. And the things you think about and the things you wish you could do.
Yeah. You told a really important story, or an illustrating story yesterday when you were talking to all of us about, do's and don'ts after your procedure, your injections, whatever it may be. You were talking about getting a lot of improvement in your pain, in your symptoms, in your scar tissue, in your disease from all your back issues, but you weren't strong yet. Yeah. You gotta do the work. Like a lot of us, I mean, maybe even me included, would come out here. Some people describe these stem cells as being miraculous. I mean, it's science. It's your own anatomy. It's your own physiology. It's your own DNA, so to speak. But, they're wonderful tools, but it's a tool. You still have to work with that tool. So when you go home, you got to do the work. If you've been out of commission for ages, just like you were saying, you had your injections, you were much better, but you weren't really better as far as function goes until you started strengthening those muscles again. And I think that's a point that some people kind of miss, or they're not really thinking about when they come out. And like I was saying, after my second treatment, I just started doing it. Like whatever I could do, I was just kind of brute forcing everything that I could do, which some of my PT colleagues recommended against, but I was just doing whatever I was capable of doing.
Yeah, I think, I think it's just like Americans in general, we just want the one shot and done.
Yeah, no.
The what's it called? Ozempic or whatever for weight loss. You know what I mean? It's like, I just want a shot and lose weight type of situation, and people don't want to put the work. For me, I was just so happy to be out of pain. It was over 11 years of just the pain and just getting worse and worse to where, I'd have nights where I was just like, what's the point?
Yeah.
I remember a point where I was coming up towards my 50th birthday, and there had been like 2 days in 1 week where I couldn't get out of bed on my own. It used to be I'd roll over on my stomach, I'd slide out, and it's funny you talk about your calves cramping. So that would happen to me too. I lost, after my surgery, this outer head of my calf completely stopped firing. It was just like a dead piece of meat there. Couldn't stand up on my toes. And what would happen was when I was sleeping, it would cramp and lock with my toe pointed.
Yeah.
And when it was one, it sucked, but it wasn't that bad.
Yeah.
Then all of a sudden, it started being both of them. And I would wake up in the morning with both toes locked, and so I couldn't put weight on them. And you have some nights like, I'm like, oh, well, I'm not even 50. I can't get out of bed. What's the point?
Yeah.
You know what I mean? Where am I going to be at 60, 55? You know, like I started thinking, I'm going to be in a wheelchair eventually here. And, that thought was in the back of my mind. They had told me, hey, you're a good candidate for a fusion. The idea of fusing my first vertebrae to my pelvis, and then the other two vertebrae above it was just like, I remember one of the doctors I talked to was like, just know when you do this fusion, they'll never bend again. Like you're going to create a new bend spot. And I didn't believe him. I didn't trust him. Thank God. When I had the stem cells, but the mind plays tricks on you. So I was down to. I had tried everything down to where I was like, yeah, let's stick some stem cells in there. Like I'll do anything. And then. It made sense. Okay, I don't have pain, but I am so weak. So I was really willing to do the work. And I think another part of it, and we see this a lot with our cancer patients, which is why we have a class here called Power of the Mind, and we have our psychologists. Is that you got to want to win up here. You got to think you're going to get better, or or you're less likely to, right? And we see, especially in cancer, if a person's mind completely gives up, unfortunately, their body is soon to follow.
Yeah.
But I also see, well over 1,000 stem cell patients that we've treated. I try to meet everybody. I can see, especially when people come back and I, if they're a little unhappy, I try to figure out, well, why, what's going on? And there's a small percentage of people that thought they were just going to get an injection in their knee and just go back and not have to do anything. Or, it's very common in shoulders, It's like if your shoulder's rolled forward, you're a side sleeper, you have an impingement, like, no, you're going to have to do something to balance it out, to build that strength back, to get where you want to get.
Yeah, what patients who are considering coming here or any place like here need to understand that this is an opportunity, you haven't had a chance to get better in doing whatever it is that you've been trying at home or in your local community, your local medical society, whatever it is. You're coming here to give yourself a shot. If you get a shot at getting, like if you go home and you're like, well, I feel better, I think I'm more functional, well, I'm not where I wanted to be. Who gives a shit? You're better. Put it to work. Go use it. Took all the time to come down here and get these things, put them to work. What do you want? Everything you got to put the work in. Doesn't matter what it is. So you just, there are certainly probably some people who are coming down, whatever their medical issue and their situation is, where they get treated, and that's good. They're not trying to do anything more with it. As long as they're not in pain, they're happy, great, but there's an opportunity for you to really, and you don't want to push it to a point where you're doing the same things that got you there, whatever it may have been, jiu-jitsu, wrestling, running, that sort of thing. But
golf.
The golf thing, tearing your body up to play golf, I can think of way more fun things to do to destroy your body.
I swear golfers are like the number one people that mess this up. It's like you get your back injected or your shoulders injected. It's like you can't even wait a month to go swing a golf club. You don't think this motion is going to...
Yeah, you're going to get it back.
Golfers, I love you, but I don't get it,
Yeah, so being patient, right? So what I was saying to some people at dinner the other night, I do a lot of tissue grafts. And when I used to do burn surgery, of course, we're doing skin grafts. Skin grafts is the easiest thing to conceptualize. People are coming to get stem cells. They're like, all right, magic cells, genetically altered. They can turn into almost any kind of tissue, multipotent, pluripotent. Putting it into my body, I'm going to get fixed. Yeah, kind of. Something like that.
Maybe. Doesn't work for everybody. But even the people it doesn't work for, it probably worked to some degree. Whether they can appreciate it, sense it, see it or not. But it is, you've probably seen, some people would say that my symptoms aren't really any better, but then you look at their scans, MRIs, whatever it may be, and anatomically there's improvement, but whatever, that's a different topic. So the skin graft thing, imagine your stem cells are like a tissue graft, a skin graft. When you take it from your thigh and you put it on your forearm to repair a burn injury, for instance, that skin graft almost always lives on almost everybody. However, it doesn't live with the same kind of robust nature on one person as it does another. Younger person's better than an older person. And no matter who it is, that skin graft doesn't have collagen holding it down to the underlying tissue for almost a week. It doesn't have blood supply even starting to sprout out for almost a week. It's getting its oxygen just kind of through diffusion. It goes through this process called impomission and inoculation, where it's just holding on for dear life. And you get to a week, well, now it has a lifeline. But it's not sturdy. When you take the bolster off and you're looking at the skin graft, it looks dead. It's wet, it's pasty, it's not impressive looking. So you still have to be extremely gentle with it. That's 1 week. That's 10 days. Then you get to 2 weeks, you get to 3 weeks, that skin graft it's still there. It doesn't look like the rest of your skin, but it's covered up that area where you basically had exposed muscle. And now it's actually starting to get sturdy. More collagen is grown in, more blood supply is grown in. If you were to bump it, it won't completely tear off. But you still got to give it time. You can start to use it. You can move around. But you can't put it in harm's way, which your example of, what would you do with a 3-month-old baby? Would you give a 3-month-old baby wine? Would you let a 3-month-old do deadlifts? No, you wouldn't. So you got to use common sense.
these stem cells are not that different from a skin graft. I mean, anatomically, cellular-wise, genetically, they're way, way different. But the timeline and the concept is basically the same. When you get these stem cells, you can't go fucking about right away. You got to give them time to do their job. Take seed in the tissues that need them or wherever you put them. And if you're careful with them, with time, you're going to do really well. Everybody gets almost everybody gets some benefit out of it. It's just a matter of how much and what are you going to do with that benefit once you get it. And if you're a person who is active before and all of a sudden you can't move and you're actually in fear for your life, once you start to get some function back, you're probably pretty happy, and I would imagine you're going to put it to use. So
yeah, I agree with that 100%. I also find people that are more active and know their bodies better can kind of figure out better what's going on.
Yeah.
People that don't do much in life, especially activity wise.
Yeah.
You're expecting to feel a huge difference. Well, you're sitting on the couch before you came. You're sitting on the couch now. Like what's the comparison? What I mean? What's the comparison that you're looking for? So
yeah.
So what kind of research did you do before you made a decision to come down here? What could you suggest to people who aren't as educated about biology and science as you are being a doctor? For them to make a decision to whether or not stem cells are right for them, whether it's us or, there's a lot of great stem cell places.
It's actually harder to answer than I would have thought. Like it's like I have a little bit of an advantage with medical training and the background in neuroscience. And it's a little tough if you know nothing about this stuff and you're researching it. I mean, I think like in my industry for plastic surgery, there's a lot of just nonsense, before and afters that aren't real. Everything is a still shot. The media or the advertisements are really just an attractive person, a patient, and they said that they had these procedures, but you need to see the evidence. What did they really look like beforehand in a video format? What do they look like after in a video format? Without a lot of commentary by the surgeon about how fabulous and these overreaching words, amazing results are. These results are, if you're looking at raw examples of people at their lowest and in raw examples in motion of people improved, I think that's a good place to start if you just know nothing about molecular biology and genetics and stem cells and that sort of thing and embryonic development. That's where I would start. You got to see the work. You got to see the evidence. When I used to put up my before and afters or just patient education videos, like I tried to make it a point to capture as much as I could on video before and after, and if I could get patients to show their entire face, which statistically wasn't that super common because I work on the face and people tend to be pretty private, so they're not anonymously showing body parts, they're showing their whole face. Whenever I got a patient who would share that with people, it was really helpful to patients, and it's also very clear, like I only did really 2 or 3 things on the face, eyes and fat grafting and that sort of thing. And it was obvious that that's what I did every day all week long. I think a patient, when they're looking at stem cell clinics, there's a lot of places where you could go around the world, around the U.S., in fact. The clinics are beautiful. It's marble floors. Everybody looks super healthy. I mean, they choose the employees pretty carefully. They really curate their patients and the testimonials. And if you just have the, in text testimonials and you just have, claims about how things are going and you see this beautiful facility. I mean, seeing a beautiful facility, I think, makes someone feel comfortable and gives them a little bit of confidence. But I would say you want to see the patients and see who they are. If some of those patients go on, and your patients are oftentimes very public figures and they can be followed. I mean, they could literally physically be followed. Some of these MMA fighters who train at different gyms around the U.S., you could literally walk to the gym, walk inside, and you can see these men and women working, training. And there's not a lot of facilities that can boast that kind of credibility, I suppose.
I think, that adds a lot of credibility for us. But for some people, it's like a detractor. They say, oh, all you treat is high-end athletes. I think we got 2 here this week, and pretty much everybody else that's here is just normal person. No one famous.
Yeah, I mean, my mom is getting treated for rheumatoid arthritis as we speak. She's getting her stem cells for the first time today.
Right.
No one's going to follow my mom in Dallas-Fort Worth area, Texas. I mean, except for her friends on Facebook. But they'll see it. And, maybe, and if it's going well, they'll communicate that to other people. But I mean, I guess that's, maybe a fair argument. Like you're just treating these high-end athletes. Well, high-end athletes are also the ones that are getting busted up at an early stage in their lives. And they also, the fact that some of them do so well, I mean, it's not smoke and mirrors. I mean, they're healthy and they're younger, so they're very good candidates for these things. You do have to be a little bit realistic if you're a patient. You're thinking about your candidacy as treatments. If you're 85 years old and you're pretty far gone in whatever your issue is, I mean, you've got a shot of improvement, but you're also got to think about what you're trying to do with it, if you get it and when you get it. So, I mean, sure, maybe the results are a little skewed in that sense, but I don't think there's anything false about it. It's actually very hard to run a high-profile public organization and bullshit people for a long period of time.
Oh, yeah. I mean, I agree. We've treated so many, 1,000-something patients. And, I wish everybody was willing to do a testimonial, but some people just don't want their face out there, like you were saying it. And back to what you're saying, like with older people is it's gonna take some more time. I think you were there yesterday when I said, hey guys, like, don't play this comparison game.
Yeah.
You know what I mean? But it's gonna happen. It always does. We'll have a super responder. People are doing really well, really fast, and they'll be super excited, want to tell everybody, and other people will not have that results. Yeah. And then sometimes they get it into their brain like, oh, this isn't gonna work for me. And it's just like, well, it's been 3 weeks, 4 weeks. Keep that mind on the prize. That's not a reason to stop going to physical therapy. That's not a reason to think that it's 3 months you got nothing. Okay, let's talk. Give me a call. Yeah. You know what I mean? But sometimes even things like disc and cartilage, it takes time. I was out of pain in a month and a half. Yeah. But my 90-day MRIs, they show some improvement, some hydration. Yeah. Nothing like my 12-month, If all I got was what I got in that first month and a half, I'd have been the happiest camper ever. That was plenty for me. But I do think that, when people play the comparison game or they have I do a very good job, or I do my best to set expectations for people, which is why I come in and talk to everybody every week, because, some people see videos of people that had really fast responses, which is, that's why I love that you're here. You're being honest. It seemed like the second time you came was a lot better, quicker results for you than the first time. Yeah,
and it made sense. I think even though there wasn't sort of this obvious jump and improvement after the first treatment, you're sort of laying the foundation for what you do in the future. Like there's a lot of things that you might have to do more than once. Like when I do fat grafting to a person's face, or when I did, they may look great, and it kind of settles and the swelling goes down, and you're left with what you're left with. And then you might, to get to where you want to be, there's an obvious improvement already, but to get where you're trying to be, you might actually have to do it again, which is fine. I mean, that's just your age, your body, your genetics, what you did when you went home. I think diet and avoiding alcohol afterwards and a variety of other things is actually pretty critical.
Yeah, I tell people that all the time. I quit drinking a long time ago. I sure feel healthier, happier too.
I like that story about the sommelier that came and he was so proud of himself that he got better even though he was drinking wine the whole time. It was just, I mean, great, man. But who knows how much better you could have been had you not been doing that. I mean, it's a legit toxin. It's one of the few things that can get past the blood-brain barrier with no trouble. That's why people love it, or one of the reasons why people love it so much. But I mean, almost everybody's a candidate for it, I would say. I don't want to overreach or overstate things too much, but I mean, my mom is 70. She's her rheumatoid had gotten pretty bad, and we were talking about this some months back, but right before we were actually about to execute this plan, she had to be hospitalized because some of the immunotherapy medications that she was on. And that was pretty rough. So I almost completely took over her care at that point, and I don't mean I kicked the doctors out of the hospital, but once we got home, the things you need to do at home to get better, that's what we started doing. The NAD that I was treating myself for, I started treating her with that. Kept her on antibiotics. She had gotten a clot in her mesenteric vein in her abdomen, which, had it been in her artery, could have killed her colon, and that would have killed her. But anyways, it was a pretty massive setback for her health-wise. So it took a lot of work with regards to diet, stretching, exercise, just to get her out here. And you saw her at dinner. She's not in a wheelchair, but in a walker that she can turn around and sit in. So it's a pretty big task to get her to go anywhere. So coming out here was rough. The first week was rough. She's been getting progressively better, not from stem cells, but just through being treated and getting detoxed in the clinic, because it's a lot. The autoimmune protocol is 2 weeks. Yeah,
it's a lot.
It's not like everybody else that comes out here for 3 days, 5 days, a week, whatever it may be. It's a long trip. If I'm not mistaken, the second visit that's scheduled is a week.
It could be a week or 3 days. Just depends what they set up or what the patient wants to do. But yeah, come back in 3 months normally.
Shorter than the first one.
A week is always better.
Yeah.
We're Americans, right? How fast can I get it done? So I think we have a 3 day. We do have a 3 day option, and we have a 5 day option for whichever one
just
people want.
Whatever you're doing, just slow it down. If you have an opportunity to do other treatments while you're here, or at least do a more complete treatment, even if it means staying an extra day, you're already here. Where are you going? What are you going to do when you get home? You're already stuck on the couch watching Netflix. There's no reason.
Do you really want to get better, or you just want to get something done quick?
Yeah. Do you want to get better, or do you want a solution? Like, you are part of that solution. You can't forget that. This technology is amazing.
I mean, the biggest part. You're the biggest part. Your brain, how you eat, how you treat yourself afterwards. I hear it all the time. On the phone, on the front end, people say, "Oh, well, place XYZ. They said I'm only there 2 days."
Yeah.
Or I can leave the same day. I'm like, well, they're not even going to follow up with you the next day to make sure you don't have an adverse reaction. How are they going to get blood work done?
Lab work. Yeah. I mean, whatever.
None of this. What if they find something in your blood? It happens to us. We'll find something out. And unfortunately, we have to disqualify somebody until they get something, with their health more lined up. It's crazy how many people have high blood pressure that have no idea that they have high blood pressure.
It's rampant. I think the thing that a lot of people in the U.S., especially in the West Coast and maybe more tense areas in the East Coast, like their stress levels and cortisol levels, this is so real. This is not they led out a really busy, hard life, and that's why they had a heart attack. I mean, yes and no. I mean, it's an actual buildup of physiologically of hormones and neurotransmitters that are bad for you, and chronically they actually are going to start destroying the lining of your vessels, cause early dementia, and it's going to get you. It's not that you're just overdoing it and you need to sleep a little bit more. No, you need to really take a step back and see what you need to do about your health, because there's things that are happening to you that you just aren't aware of. So it's rough out there.
Health is wealth.
Health is wealth. I've got so many patients that come in and they're worried about one spot on their face, but they're otherwise, look pretty great and they're in pretty good shape. If they would just focus on their health, they'd look amazing and they'd feel way better. I've never looked at a building that I was thinking about purchasing. I don't purchase buildings, but if I did, I wouldn't look at a building and disqualify it because one brick had a chip in it or something like that. They're worried about a chip in one brick and the entire building of their body. They just need to lift weights, eat well, stay active, be around friends and family, remove things from their lives that cause them a lot of stress needlessly. I mean, we're not talking about family and kids and that kind of thing. But I've got so many patients. I'm like, if you just had a smile on your face, if you just were doing things a little bit differently in your life, you would look much better. And they're like, well, I'm aging. I'm like, I know.
Guess what?
I know we all are, but during that time, the lead up to my stroke, I noticed like, I mean, I could see signs of arteritis or like issues with blood flow to specific parts of my body. Like I could see signs that something was up. And I was telling Yolande, the young woman that was with me the first trip that I was here, she asked me later, why didn't you slow down? I mean, there's a lot of reasons why, but it's like I knew something was coming. I just didn't know when, and I knew it was soon. And a couple of weeks before I'd gone on that trip, I was sitting in the OR, and we're talking constantly in the operating room. It's weird, actually, if an OR goes silent, that means something's wrong. And I just made a comment to everybody. Somebody said, "Well, you're going to be doing this for 10 more years." And I don't know what prompted me to say it. I was like, I may not be around here that much longer doing this, And looking back, I don't even know why I said that. And sure enough, 2 weeks later, I'm I'm unemployed in my own office on disability. Having to rethink my entire life. One amazing thing about this whole situation is like your priorities. Like people would say, well, your priorities, you can see them much more clearly when things become dire, but you see them really clearly. And I know this, that if I'm not doing things that I think are important to me and the people in my life in the next 6, 12, 18 months and I have another stroke, I'll be fucking pissed. If I'm back in the office and I'm doing a bunch of things that I feel like I don't need to do, that would be upsetting. But if I've taken care of my life, my sons, my family, my friends, and I had another stroke, I'm okay with that.
Yeah.
Yeah.
It's I definitely understand that. This is my 9th year working with cancer patients, and you learn a lot.
Yeah.
When you're around people, closer to the end.
Yeah.
I'll say, especially when they realize it. And God, I get to have the best conversations. Just real, honest conversations, getting to know the patients when they're here, and getting that chance to help them pull out what's really important for them, and make those apologies, rebuild those connections, whatever it is. It's really touched me, and I really feel a purpose of like, hey, you're having a bad day. Well, I'm going to go sit in your hospital room with you for 15 minutes, or all damn day, until we can shift the mood, and focus out and get that going. It's, I've had so many, I could think of so many cancer patients that we had down here that finally did their life purpose, finally wrote that book, finally painted that painting, finally, healed that relationship, whatever it is that they absolutely had to do. And, sometimes that kick in the nuts that we get in life is what we need to really live,
But if you can avoid it, do those things without getting kicked in the nuts, that's even better.
I've been kicked in the nuts in a lot of fights. I'll do everything I can to avoid getting kicked in the nuts. So, that's been the kick in the nuts for me. Is, okay, Scott, I hear what you're saying out of your mouth to this person. You need to apply that to your own life.
Yeah.
And I feel like I've been lucky. I've gotten to apply a lot of it.
That's good. So that's good. Yeah, I admire what you guys do here, and it's the sort of thing that I think a lot of people in my line of work would love to be a part of if they had the opportunity. But practicing medicine in the U.S. is not like what you guys are able to do here.
Special.
It's special.
Especially, people try to poo-poo on, Tijuana, but I'll tell you the level of actual caring, right? Yeah. People say, care, and they equate care to the medication that the doctor is prescribing you, or
stainless
something like
steel,
that.
Linoleum,
the things like the fanciest IV chair, or like what you're saying, the nicest marble floor, or whatever it is. The culture down here, it to me, it's real caring. It's real, like, if it takes an hour with a patient, they're going to spend an hour with
definitely.
you. And so it's a different kind of, family's very important down here.
Yeah.
And you can really feel that. I feel like my whole staff is my family. I'm very protective of my staff. Just a couple weeks ago, a guy got here's your refund, get out. You think you talk to my staff like that? I don't know. Gone.
That's too bad.
And the look on his face, we couldn't believe it. Like, yeah, no, I don't want your money. Like, I don't want you anywhere near anybody here. It's like, well, one bad apple, you see cancer, you cut it out. You're going to poison the rest of the people that are here. People are complaining about you. You're a jerk to the staff. Like, there you go. Back to San Diego, buddy.
Yeah. No, you don't want to introduce or allow negativity like that to linger in a place like this. It really can affect things badly.
Yeah, bad energy, bad vibes. So
you don't need that much gear, equipment to give good care. Like, that place I was in Belize was amazing. It was awesome.
Yeah.
Some of the best surgical care I think ever, and post-op care I've ever given to people was when I've been working in Vietnam with really limited resources. I was out there doing surgeries and teaching in Hanoi, up north. In the South, they don't really need you quite as much. They've got more stuff, more money, better infrastructure. But you really learn a lot about medical care when you do it outside of the U.S. I was not super pleased with my mom's care over the last fall and last winter before we got her out here. I think it could have been a lot better. And she probably would have been in much better shape coming out here if things were different. So.
Yeah. Well, I'm glad she's here now. And it's pretty cool. Like, I hear from patients all the time where, doctors in the U.S. just, poo-poo on coming to get something outside of the country or stem cells. It's fake. There's just a scam. It's like, what research have you done, buddy? It's like stem cells been around a long time, and I think the volume of success cases sure outreaches the failures.
Yeah. And I've been very impressed.
Yeah. Well, thanks for coming on the show, man. I'm so happy that we got a chance to sit down and see you doing so much better. And
thank you. I think
you got one more trip that you're coming back down. You coming with your mom again?
I'll probably come. I may come back with her when she comes again. My sister's now thinking about coming down for a treatment, but for sure I'll be back with her, possibly by myself into the year next year. And I'm looking forward to seeing how these systemic stem cells I do this time. Haven't quite maxed out, but I'm doing 160 million. Actually, I got 70 million right.
Pretty close.
Yeah, I got 70 million right before I came here, and we're going to do the rest this afternoon and do some hyperbaric oxygen. So
awesome.
That's what's up.
All right. Thanks, buddy.
Thank you.